Hi friends, this is Dr. Apurv Mehra, and I represent Team Conceptual Orthopedics here. And with me is Dr. Sunil Kumar. Sunil, tell us about you. First of all, start with your parents' name.
Sir, myself, Dr. Sunil Kumar, sir. My father name is Peddana and mother name is Premda, sir. I am from Karnataka, sir. District name Ballari. I studied my postgraduate in Vijayanagara Institute of Medical Sciences. Sir.
All right. So you have cleared your orthopedics exam.
Yes, sir. I have cleared in August, sir.
Fantastic. So tell us your experience about preparation. How did you approach your preparation?
Firstly speaking, I generally blindly believe few people, sir, and one among is you, sir. Thankful to you, sir, for this conceptual orthopedics, sir, which reached my heart. And beginning with how I studied is I became a premium conceptual orthopedics subscriber in November 2000, sir, 2020, sir. Like in my first year of residency. Then I started with basics, sir, like how to apply a cast, which was very helpful in my minor casualties, sir, and how to remove a drain and and what are the composition of cast, POP, tractions, and functional positions of various joints, what we do in daily routine, sir. As I progressed, like most common in our casualties are trauma. So then I started watching trauma videos by Dr. Shailesh Pai, which was amazing, sir. It was very useful to us, just like we remembered everything, even classification and how to approach in OT tables. Like it was very helpful, sir. Then I started by on the same way I started making my own notes that with in the notebook, sir. But one thing I lacked was I it couldn't connect with my visual memory, sir. I was able to recall, but it was little bit difficult. Then I switched on with making notes with iPad, sir. I have taken an images. Then I have collaborated with lecture videos, sir, so that while revising, the visual memory comes in front of me and reproduction is very easy, sir. So that was very helpful. And as the days progresses, like for second year residents and all, there will be clinical case presentation, sir. And I started with that clinical video, sir. I discussed with my friends, so demonstrated on my friends. So it was very useful. All clinical examination videos were very useful, sir. Even long and short cases. And on the end of my second year PG residency, I started with cold orthopedics, sir, and even some basic sciences topics which was not covered in first year, which was very useful. And every teacher, like 31 teachers in conceptual orthopedics, they are pioneers in their own region, sir. So I'm very thankful to conceptual orthopedics, and everything is just available in one tap, like in my phone, and I can see whenever I want where I am there, even out of station. It is very useful, sir.
Right. So Sunil, what I understand is you were utilizing the videos,
Yes,
looking at different notes.
yes, sir.
You were able to correlate it with your learning in post-graduation, the residency, and
Yes, sir.
it's also helping you to prepare your notes along with your overall understanding of orthopedics as a branch.
Yes, sir.
Right. So when you were going to the clinics or looking at the patients,
Yes, sir.
the clinical videos, were they helping you?
Yes, sir. Sure, sir. Like today, example, sir. Today we have admitted some 3-4 cases of like it may be hip joint. Then I went to my home. I watched many videos, and I've gone to the clinical examination book which you provided, sir. Then tomorrow we have examined him. We examined that order with my friends. So we have discussed and we presented the case. So some mistakes they would have been corrected us, but it was very helpful, sir. Like videos are very helpful. As I said earlier, the visual memory will be very good, sir. And it was taught by pioneers like Dr. Professor S.M. Tuli, sir, and many more. So we can reach them easily through conceptual orthopedics.
Do you feel sometimes that they are holding your hands and teaching you?
Yes, sir, sure, sir. Because just a few meters distance. That's all, sir. Like they can reach us heart easily through this conceptual orthopedics. So it is very difficult to reach the remote places of India. That so it is very useful through this app, sir.
Yeah. And I'm very happy the way you are telling me, because the aim of conceptual orthopedics is to improve you as a clinician, to
Yeah, sir.
improve your experience of residency.
Yeah, sir.
Passing an exam is just a byproduct. That's never the aim,
Yeah,
right?
sir.
Because an exam is just once at the end of 3 years.
Yeah,
But every patient that comes to us, every surgery that we do,
yeah, sir.
right? That's a test for us every day. That's one.
Yeah,
And
sir.
more importantly, if you look at the other way around, right? It's like for that patient, this is the only chance. You are the
Yeah, sir.
only, so you have to be prepared. Fantastic. And as you told, you took two beautiful names of Dr. Shailesh Pai teaching you trauma and Dr. Professor S.N. Puri sir teaching you clinical examination, right? What about the lectures by Professor Anil Dhal sir? How much did you love them every Thursday?
Sir, it was actually very useful, sir. Like I watched almost all the videos, like Anil Dal sir hand videos. Just still I remember the flexor zones of hand. He made me hand very easy, sir. So I got some interest in hand. It was very helpful, sir. And
Anybody else that comes to your mind when you look at the teachers?
yeah, sir. Pediatric orthopedics by Dr. Professor Kumar sir is at present is not there, but I am very thankful to him, sir. Actually, pediatric orthopedics it is little bit difficult to understand, so he made me very easy, sir. Along with Fahim Kotekar, sir, they made pediatric orthopedic very easy. And oncology, sir, by Vivek Verma, sir. That collaboration with the radiotherapy team, he came during the lectures was very helpful. At least we can understand what's going on. We'll not be seeing it directly, but at least they're able to explain us what's going on and how is that. So it was very helpful, sir.
Fantastic. Now, if I look at this overall, Dr. Sunil, what I understand is that when we were trying to build conceptual, right, our aim was probably that we create a content that keeps on teaching the world, right?
Yeah,
And look at this, what you just said. It is very disheartening today that we don't have Professor Gopa with us, but his
yes,
lectures, his teachings, we can just listen to him and see him. And what
yes,
a beautiful teacher and how humble a
yes,
human being he was. He'll always be in our heart forever. All right.
yes, sir.
Sunil, now what's your plan ahead? What do you want to do ahead?
Sir, I want to complete my senior residency, sir, as of now for this academic year. Next, I want to do my fellowship in arthroscopy.
We, as a team of Conceptual Orthopedics, all the
Yes,
teachers, right, believe that the learning never ends.
yes, sir.
May your journey of learning become more and
Yes,
more beautiful as it goes down. May
yes,
God always bless you. My suggestion is do your senior residency properly.
yes, sir.
Learn to acquire a skill of a basic orthopedic surgeon.
Yes, sir.
And yes, then you can branch out ahead towards the specialization in a fellowship.
Yes, sir. Thank you, sir. Actually, I am a big fan of you. Still, during my UG days, sir, I was your ODD's orthopedic Doom Dhamaka subscriber, and I heard your lecture in first bench of my preparation, sir. Actually, from there, you inspired me a lot, sir.
God bless you. It's always nice to hear these words from a student. And we are all the students of science in this wonderful branch called as orthopedics.
Yes, sir. I had one suggestion, sir. Like
Yeah.
which you people can improve for us among all the postgraduates, if possible. I can tell.
Please do that.
Sir, like one thing, most of my friends we had a batch of postgraduate 13 people, sir. All of, out of 13, 11 are conceptual orthopedic subscribers, sir. Like all with all the reviews and from other colleges, I had some input, sir. Like the lectures that's are going on in conceptual orthopedics videos and notes, the little bit they're unsynchronized, sir. Because example, like carpal instability, which was taught by Dimbri, sir, it's very like very conceptual, sir. Like he taught us very nicely. It can easily understand us, sir. But little bit, if we go to notes, like notes are mainly for exam purposes. I can understand that, sir. But little bit there is a asynchronization, sir. So notes like the images shown in classroom, along with that, if you make a notes, so while revising, it will be very useful, sir. As you said, it's not like only for exams. For future also can refer that, so it will be
Fantastic.
very useful.
That's
So
good.
it's my
So
small suggestion.
let's do this together. Find out
Yes,
the
sir.
lectures where you want us to
Uh,
give you favorite notes. We will convert those lectures into notes.
yes, sir. Sure, sir.
So that's your homework now.
Yes, sir. Sure, sir. Actually, I have made many notes. I have found that also, sir.
Share it with us.
Like sir, I have already made it, collaborated it, sir. Like I was waiting for you appointment so that it can reach you. So if possible, sir, I
Give it,
can.
give it to us. We will place it beneath the lectures.
Yes, sir. Sure, sir. But actually, it is handwritten, sir. That's the
Doesn't
problem.
matter. We will get it edited and formatted.
Yes, sir. Sure.
Thank you very much. But in the video that we release, we will not be releasing this part.
Okay, sir. Sure, sir.
God bless you and congratulate your family on my behalf and everybody here.
Okay, sir. Thank you, sir.
Thank you, Sunil. All the
Thank
best
you.
for the future. Bye, bye, bye. Thank you.
Okay. Thank you.